Type 2 diabetes, the most common type of diabetes, is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is your main source of energy and comes mainly from the food you eat. Insulin, a hormone made by the pancreas, helps glucose get into your cells to be used for energy. In type 2 diabetes, your body doesn't make enough insulin or doesn't use insulin well. Too much glucose then stays in your blood and not enough reaches your cells.
Signs and symptoms of type 2 diabetes often develop slowly. In fact, you can be living with type 2 diabetes for years and not know it. When signs and symptoms are present, they may include increased thirsty, frequent urination, increased anger, unintended weight loss, fatigue, blurred vision, slow healing sores, frequent infection, and numbness and tingling in the hands or feet.
Type 2 diabetes can develop at any age after the age of 30 years, and it is common nowadays. It is common in childhood also, especially in Asian countries. Type 2 diabetes has become common at the age of 30 years also. Another important causes for type 2 diabetes like family history or genetic cause, then sedentary lifestyle, obesity or weight gain, overweight, that is important cause for type 2 diabetes. Then certain drugs, patient on having drug therapy like steroids, hormonal therapy, they are also responsible for type 2 diabetes. Then health conditions like blood pressure, heart disease is also mainly responsible for type 2 diabetes. Then viral, especially we know that last 2 years back, coronavirus. So viruses, coronavirus and other viruses also can cause diabetes. Then physical stressful conditions like pregnancy, that is also important cause. And mental stress and additions like alcohol, tobacco is also responsible for type 2 diabetes.
Type 2 diabetes is usually diagnosed using the glycated hemoglobin A1C test. The blood test indicates your blood sugar level for the past 2 to 3 months. The results are interpreted as follows. Below 5.7% is normal. 5.7% to 6.4% is diagnosed as pre-diabetes. 6.5% or higher on 2 separate tests indicate diabetes.
Some complications of type 2 diabetes. 1. Hearing impairment. Hearing problems are more common in people with diabetes. 2. Sleep apnea. Obstructive sleep apnea is common in people living with type 2 diabetes. Obesity may be the main contributing factor to both conditions. It is not clear whether treating sleep apnea improves blood sugar control. 3. Dementia. Type 2 diabetes seems to increase the risk of Alzheimer's disease and other disorders that causes dementia. Poor control of sugar levels is linked to a more rapid decline in memory and other thinking skills. Lions will say.
Kidney disease. Diabetes may lead to chronic kidney disease or irreversible end-stage kidney disease, which may require dialysis or a kidney transplant. Eye damage. Diabetes increase the risk of serious eye damage such as cataract and glaucoma. and may damage the blood vessels of the retina, potentially leading to blindness. Skin conditions. Diabetes may leave you more susceptible to skin problems, including bacterial and fungal infections. Slow healing. Left untreated, cuts and blisters can become serious infections which may heal poorly. Severe damage might require two foot or leg amputation.
Along with following your diabetes care plan, you may need diabetes medicine, which may include pills or medicines you inject under your skin, such as insulin. Over time, you may need more than one diabetes medicines to manage your blood glucose. Even if you don't take insulin, you may need it at special times, such as during pregnancy or if you are in the hospital. You also may need medicines for high blood pressure, high cholesterol, or other conditions.
Some people who have type 2 diabetes need insulin therapy. In the past, insulin therapy was used as a last resort, but today it may be prescribed sooner if blood sugar targets are not met with the lifestyle changes and other medications. Different types of insulins vary on how quickly they begin to work and how long they have an effect. Long acting insulins are designed to work overnight or throughout the day to keep the blood sugar levels stable. Short acting insulins might be used at mealtimes.
If you have risk factors for the disease, here are some things you can do to lower the risk. Eating healthy foods. Choose foods lower in fat and calories and higher in fiber. Focus on fruits, vegetables, and whole grain. Getting active. Aim for 150 or more minutes a week of moderate to vigorous aerobic activities, such as brisk walking, bicycling, running, and swimming. Losing weight. Losing a modest amount of weight and keeping it off can delay the progression from pre-diabetic to type 2 diabetes. If you have pre-diabetes, losing 7 to 10% of your body weight can reduce the risk of diabetes.
Type 2 diabetes used to be known as adult onset diabetes, but both type 1 and type 2 diabetes can begin during childhood or adulthood. Type 2 diabetes is more common in adults, but the increase in the number of children with obesity has led in more cases of type 2 diabetes in younger people. There is no cure for type 2 diabetes, but losing weight, eating well, and exercising can help you manage the disease. If diet and exercise ain't enough to manage your blood sugar, you may also need diabetes medication or insulin therapy.